this video we are going to do the skeletal muscle relaxants. So what does skeletal muscle relaxant means? They're the drug which relaxes the skeletal muscle. They reduces the tone of the skeletal muscle, either acting centrally or peripherally. Okay. Now, if we talk about the normal physiology of the skeletal muscle contraction, so what's gonna happen? The nerve impulse gonna come to the neuron terminal. The acetylcholine will be released. The acetylcholine will combine with the receptor, the acetylcholine receptor in NMJ. Okay. Then after that, after binding with the receptor, there's gonna be entry of a sodium ion inside the inside the end plate. Because of that, there's going to be entry of the sodium. Because of this, there's going to be end plate potential. Okay, and because of this, the entry of the calcium will also increases, and there is going to be sliding of actin filament over the myosin filament, and the contraction will happen. But after some time, we don't want the contraction all the time, because if there's going to be contraction for all the time, so there's going to be condition called the tetanus, because in tetanus the person go in the state of the spastic paralysis, which we don't want it. We want contraction and relaxation according to our needs. Okay. So when the contractions happen, so when after some time the cholinesterase will come, and it will cause inactivation of the acetylcholine, and after that the laxation will happen, and the neuron will be ready for the next contraction. Okay. Now if we talk about the classification of the skeletal muscle relaxant, so I have written over here in my notes that I guess it's visible. So the skeletal muscle relaxant is going to be divided into centrally acting and the peripherally acting. So for remembering the centrally acting, I wrote a mnemonic called "Car mein chalo diya बैठी थी." Okay, so this is for the centrally acting skeletal muscle relaxant. So car is carciprodol, may is methocarbamol, okay, chalo is chlorzoazone. Okay, then dia is diazepam, be is baclofen, thi is thiaclococide, and thi is thiazanidine. Okay, what is that? कार में चलो दिया बैठी थी. Carciprodol, methocarbamol, chlorzoazone, diazepam, baclofen, and thiaclococide, and thiazanidine. Okay. Now, if we talk about the peripheral acting is going to be divided into two classes: the drug which are going to act on the skeletal muscle, and the drug which are going to act on the NMJ. Okay. The drug which are going to act on the skeletal muscle directly is dantrolene, while the drug which are going to act on the NMJ is going to be divided into three classes: the depolarizing agent, non-depolarizing agent, and others. So in depolarizing agent, we are going to have two drugs: succinylcholine and dexamethonium. Succinylcholine and dexamethonium. And in non-depolarizing blockers, there are three classes: long-acting, intermediate-acting, and short-acting. Okay, so for remembering this, you have to remember three mnemonics, which I written it over here: 2, 3, and 4. Okay, so the first is Pandu Pittu. So for remembering the long acting, you need to remember Pandu Pittu. So what is Pandu Pittu? PAN is pancuranium, D is doxycuranium, and Pittu is pepicuranium. And just also remember the D-tubocurarine. Okay, Pandupittu, pancuranium, doxycuranium, pepicuranium, and D-tubocurarine. And intermediate, you need to remember Vacra soagni. Now Vacra is V with V is vacuranium, A atracurium, C cisatracurium, and R is rapacurium. And short acting is Mia. So the short acting drug is mevacurium. Okay, and the non-depolarizing, the other were botulinum toxin. Okay, just I'm gonna do the peripheral acting drugs again, and then we will move on to other topics. Okay. So the peripheral acting are direct acting on the skeletal muscle and direct acting on the NMJ. Direct acting on the skeletal muscle is ventrally, and direct acting on the NMJ is depolarizing, non-depolarizing, and others. Non-depolarizing blockers contain the succinylcholine and dexamethasone, the non-depolarizing blockers contain the pancuranium, doxycurium, epipicurium, and D-tubocurarine. Intermediate contain the vacurium, atrocurium, cisatrocurium, and rapacurium, and the short acting contain the mevocurium. Okay.